watching us on Local Edition. I'm Brad Pomerance. We are joined today by Jason Farned. He is with the San Gabriel Valley Mosquito and Vector Control District. We're in summer. It's mosquito season, although it feels like all year is mosquito season.
That's right.
But before we talk about mosquitoes, what exactly is vector?
A vector is any animal or organism that transmits diseases to humans or other organisms.
Okay, so with your organization, obviously you're looking at mosquitoes, but what other vectors, can you pluralize vector to vectors?
Yep, that's right.
Are there that are of concern?
Well, there's ticks. Ticks are a vector for Lyme disease, and fleas transmit typhus. But primarily our district deals with mostly mosquitoes.
Okay, and I want to talk about mosquitoes. I was watching a show on another network, and it was, the title was 10 Most Deadly Animals to Humans. And you'd expect, you know, sharks and leopards and lions and bears, oh my, but the number one most dangerous animal to humans, mosquitoes.
Yes, and
by far.
By far,
Explain.
Yeah, so mosquitoes kill over 1 million people every year through
A million?
Through mosquito-borne disease. And a lot of that is malaria in places like Africa and other tropical vector-borne diseases in South America.
And it's interesting you mentioned malaria, because malaria had been a very significant concern in the Americas as early as the last century. I mean, we know several presidents' siblings and wives died of malaria. And so it was a very disease of tremendous concern. Not as much now in the America, or at least in North America, is that fair?
Yeah, in the United States it's not a big concern now. There was a concerted effort to try and get rid of it, and through infrastructure, design, public health, just public education.
But in Africa, malaria is still a very significant problem.
That's right.
So let's talk about the challenges, though, here in California. We keep hearing about, I mean, I've been covering the region for over 10 years, West Nile virus. What exactly is West Nile virus, and why does it continue to be a concern here in California?
Well, West Nile virus is the most prominent mosquito-borne disease in California. It can be deadly, and it is endemic in the state, which means that it's always present in the environment.
Is it more likely to be transmitted during a certain time of the year?
Well, it's in the environment year-round. It survives in the bird population. It's actually a virus that affects birds. The virus is just transmitted through mosquitoes.
I see.
And so
the mosquito bites the bird and then bites you and me.
That's right. And so as the weather patterns make the mosquito population fluctuate, as the population of infected birds and the population of infected mosquitoes increase, there's a greater chance that humans are infected.
Explain the weather patterns that cause mosquito populations to rise. When do we see that?
Well, like you said, the mosquito season's getting shorter and shorter. It used to be during the summertime, during the hotter weather. But mosquitoes need water to grow. They lay their eggs and develop in standing water. And so the water temperature affects the rate of growth, and if they're able to survive, they can't survive in the colder water. And then adult mosquitoes don't survive well in the colder weather either.
So our climate in California is pretty darn good for mosquitoes.
Yeah, really good. There's really just a short window of time where they don't do very well, especially with the warmer weather that we've been having in the shorter winters. We're starting to see mosquitoes earlier in the year, around March or April, and going all the way into September, October.
Now, in Florida, there was a big scare relating to the Zika virus. I felt as if that scare didn't reach to our coast. But should we be concerned about Zika, which was, I believe, mosquito-borne?
Yeah, so Zika is a mosquito-borne disease, and we should be concerned about it here. Different mosquitoes spread different diseases. And so the particular mosquitoes that spread the Zika virus are only in certain areas in the United States.
And that mosquito is known as the, how do you say it, Andes?
The Aedes mosquitoes, yeah.
Okay.
So Aedes is a genus. There are 2 mosquitoes that are now here in Los Angeles County that are capable of transmitting Zika, the Aedes aegypti and Aedes albopictus.
Okay.
And both,
so they're here?
They're here, yeah.
When did they get here, do we know?
Around 2011.
Do we know how?
Through shipments of goods and services. We're thinking lucky bamboo from Southeast Asia, or used tires. These mosquitoes travel pretty easily. Their eggs remain viable for several months, maybe even a year or more, waiting for the right conditions to hatch. And so they can survive in dry containers. And when those containers get shipped all over the world, you can move these mosquitoes around.
And so those types of mosquitoes are here. have we found anyone that has contracted Zika here, not came here and had it?
Right, yeah, and that's a really important distinction. So right now, none of the mosquitoes are currently transmitting the Zika virus that we know of.
Right.
And I say that because that could change at any moment.
Of course.
And we're preparing for that possibility because anytime you have a vector of a particular disease or
and that's
virus,
the Aedes, you
that's
say.
the invasive Aedes mosquito. Now that we have those mosquitoes here, we could have local transmission.
And it's not just Zika in which these Aedes mosquitoes transmit. They also can transmit dengue fever, is that right? Yellow fever. What else is it? Where else are we at
Yeah,
risk?
there are a lot of different tropical viruses that the people of California have never had to worry about before. The ones that you mentioned, dengue, yellow fever, there's also chikungunya, and of course Zika, and a bunch of others. And so the concern is now, before that mosquito was here, we didn't have to worry about those viruses. Now the mosquitoes here, we do. And the way local transmission will occur is when a traveler who has traveled outside the country or outside the state gets bit by a mosquito there. That mosquito gives them a particular virus. They come home or they travel here to Los Angeles and get bit by one of our mosquitoes. It introduces that virus into the local population of mosquitoes.
Are any of these diseases transmittable if you're near someone that has West Nile or Zika or whatever, dengue?
None that if you're just in proximity. No physical or casual contact.
Right.
But Zika virus can be transmitted sexually or through some bodily fluids.
And that's been the risk with the Zika babies you've seen. They've had smaller heads. And let's talk about prevention.
Sure.
What can we do here in Southern California, California generally, to limit our risk of mosquito-borne illness?
Well, there's two things that you can do. One is reduce the mosquito population so you're less likely to get bit, and then protect yourself from mosquito bites.
Okay.
And so in the first incident, like I said, mosquitoes grow in water. So by eliminating the standing water that these mosquitoes need to survive, pretty much any water that sits for more than a few days or longer. No, a pool is circulated.
I see.
So pools, fish ponds, water fountains, anything that has a pump or has circulating water, you don't have to worry too much about. It's more like the sources of water that is just standing water in the gutter or in a bird bath.
And what's your sense of repellents?
So the EPA has registered 4 repellents that have been tested to be effective. Are not repellents necessarily, active ingredients. And so when you're out looking for repellents, you want to find one of the active ingredients that the EPA suggests. So there's DEET.
And what do you think of DEET?
Are
we okay with DEET?
DEET is the gold standard.
Right, because
I'm okay with DEET.
You hear some people concerned about DEET.
And there are other options. I understand people's concern with DEET. For me, the risk of contracting mosquito-borne disease much
little
outweighs,
knowledge can be scary.
That's right, yeah. It outweighs any risk that DEET. But there's also picaridin, IR 3535, and oil of lemon eucalyptus.
In our final moments, is it true that mosquitoes like certain blood types, or they can smell a certain type of human and they like those better than others?
I actually get asked that question a lot, and there's no definitive research that shows yes or no. People have their hunches and their wives' tales about certain things that they eat. But yeah, some people do get more, others, some people react differently, so they just think they're getting bit more.
I want to thank you for joining us. His name is Jason Farned. He is with the San Gabriel Valley Mosquito and Vector Control District. Stay safe this summer. Mosquitoes can be very risky for humans. I'm Brad Pomerance. It's Local Edition.